Hello, students. A very good morning to all of you. I welcome all of you to this session of mucormycosis. Although it's rare, it is a very serious infection. It is caused by a group of molds known as mucormycetes, which is present naturally in the environment. It mainly affects people who are on medication for different types of health problems that reduces the ability to fight environmental pathogens. Sinuses or lungs of such individuals get affected after they inhale this fungal spores from air. Doctors have stated that in cases of mucormycosis among people hospitalized or people recovering from COVID-19 with some requirement urgent surgery. Usually mucormycosis does not pose a major threat to those with healthy immune system. So I request all the children's, students, as well as parents and people who are listening or watching to this video, please don't go out unnecessarily. Please follow the rules and regulations of government which has been imposed during this lockdown, because in environment everywhere different types of spores of fungus are present, different types of millions of organisms, that is microorganisms, are present in an environment. They are present in our body. If our immune system is strong, we no microbe will affect us. But if our immune system is weak, means to say sugar patients, BP patients, any other kind of health ailments, or less blood level in the body, so with this they are easily going to be affected by different types of diseases, not only coronavirus. So I request all of you, stay home, stay safe. So let me start this session with these words, that health is wealth. I am sharing the screen with you regarding my slides of mucormycosis, that is black fungus. Let us see what is this in brief. Mucormycosis is also known previously as zygomycosis. It's a serious, as I said, but rare fungal infection caused by a group of molds called mucormycetes. These molds live throughout the environment. Mucormycosis mainly affects people who have health problems, as I said to all of you, or who take medicines that lowers the body's ability to fight germs and sickness, that is immunosuppression. It is commonly affects the sinuses or the lungs after inhaling fungal spores from air. It also affects or infects our brain. It can also occur on the skin after a cut, burn, or other type of skin injuries. Where mucormycosis comes from? As I said, mucormycetes are the group of fungi causes mucormycosis. They are present throughout the environment in the air. Particularly, they are also present in soil, association with decaying organic matter such as leaves, compost piles, and animal dung. They are more common in soil than in air. Please remember this. This is a very important point, students. They are more commonly, that is, mucormycetes are more commonly present in soil than in air, and in summer and fall than in winter or spring. Most people come in contact with this fungal spores every day. It's probably impossible to completely avoid these spores. These fungi aren't harmful to most people. However, please note it. However, for people who have weakened immune system, breathing in problem, mucormycete spores can be taken in and cause infection in lungs or sinuses, which spreads to other parts of the body as well. And mainly, it's going to infect the brain. Why it is called? Why this mucormycosis is called as black fungus? Because black lesions on nasal bridge or upper side of mouth that quickly becomes more severe. The what to say? The nasal blockade, a congestion, or nasal discharge is black in color. The condition is informally referred to as black fungus. Hence, the name came to existence as black fungus. Now, what are the types of mucormycosis? Pulmonary lung mucormycosis is the most common type of mucormycosis in people with cancer and in people who have had organ transplantation or stem transplantation. Gastrointestinal mucormycosis, it is more common among young children than adults. Please, children, take care. Please don't go out unnecessarily. Please don't go and play more time during this lockdown outside. Especially premature and low birth weight infants less than 1 month of age will also be infected, who have had antibiotics, surgery, or medications that lowers the body's ability to fight germs and sickness. In turn, indirectly, it refers to immunosuppression. Rhinocerebral, that is sinus and brain. Mucormycosis is an infection in the sinuses that spreads to the brain. This form of mucormycosis is most common in people with uncontrolled diabetes and who have kidney transplantation. Please, please listen carefully, students. Cutaneous or skin mucormycosis occur after the fungi enter the body through a break in the skin after a surgery, burn, or any type of skin infection. This is the most common of mucormycosis among people who do not have weak immune system. Even healthy immune system people are affected by this virus. Sorry, this fungus. I mean to say this fungus, that is cutaneous mucormycosis. But it's not very serious infection for people with healthy immune system. Finally, disseminated mucormycosis occurs when the infection spreads through the bloodstream to affect another part of the body. The infection most commonly affects the brain, but also infect other organs such as spleen, heart, and skin. That is the reason mucormycosis is very dangerous infection. Now, what happens when one contracts it? The warning signs include pain, redness around eyes, nose, fever, headache, coughing, shortness of breath, bloody vomits, altered mental status, that is sinusitis, the nasal blockade or congestion or nasal discharge, as I said, in black in color, bloody in color. Local pain on cheekbone, one-sided facial pain, numbness or swelling, blackish discoloration or bridge of nose, loosening of teeth, jaw involvement, double vision with pain or blurred vision, thrombosis, necrosis, skin lesion, chest pain, pleural effusion, worsening of respiratory symptoms. Apart from this, shortness of breath also is there in this, gastrointestinal bleeding is there in this, blisters formation is there, and moreover, expert advise that one should not count all cases of blocked nose as cases of bacterial sinusitis. It is even fungal sinusitis due to immunosuppression, or COVID-19 patients on immunomodulators. Do not hesitate to seek aggressive investigations for detecting fungal infections. You have to know what kind of infection is this. These are the symptoms. Now, next, who gets mucormycosis? It's a big question mark. As I said, discussed with you about types of mucormycosis. Even healthy people will get affected by mucormycosis. But more often, mucormycosis is really rare. It's more common among people who have health problems or they have taken corticosteroid medicines, which lowers the body's ability to fight germs and sickness. That is immunosuppression. Certain people, group of people, are more likely to be mucormycosis. That is what kind of people? Diabetes people, especially with diabetes, ketoacidosis, cancer, organ transplantation, stem cell transplant, neutropenia, that is low now number of white blood cells, long-term corticosteroid uses, injection drug use, too much iron in the body, too less iron in the body, skin injuries due to surgery, burns or wounds, premature delivery, or low birth weight. These are the very few patients, or these are the very few people who are going to be affected with mucormycosis instantly. Even you'll get one-sided headache also. How can I lower the risk of mucormycosis? Actually, it is very difficult to avoid breathing in fungal spores because fungi causes mucormycosis. They are common. They are everywhere present in the environment. There is no vaccine to prevent mucormycosis. For people who have immune system very weak, there may be some ways to lower the chances of developing mucormycosis. Protect yourself from the environment. It's important to note that although these actions are recommended, they haven't been proven to be preventive against mucormycosis. Try to avoid areas with a lot of dust, like construction or excavation site. If you can't avoid these areas, wear mask. That is N95 respirator are a good mask. Please wear mask wherever you go. I request, even if you go out of your house, even to buy milk, please wear mask. Avoid direct contact with water damaged buildings and flood water after hurricanes or natural disasters. Usually it happens sometimes. Avoid activities that involve close contact with soil, dust, such as yard work or gardening. If this isn't even possible, wear shoes, long pants, long sleeve shirt. Outdoor activities such as gardening, yard work. Wear gloves when handling materials such as soil or manure to reduce chances of developing a skin infection. Clean skin injuries well with soap and water and get less exposed to soil and the dust. How is mucormycosis diagnosed? Healthcare providers who suspect that you have mucormycosis in your lungs or sinuses might collect a sample of fluid from your respiratory system. They'll send it to laboratory, then they'll inform you through the tissue biopsy whether you have been infected with mucormycosis or not through a fungal culture. You may also need imaging tests such as CT scan of your lungs, sinuses, or the other parts of the body, depending on the infection of the suspected organs. Treatment. As I said, there is no full treatment or vaccination for this mucormycosis. It's a serious infection. It needs to be treated with prescription antifungal medicine, usually amphotericin B, posaconazole, or isobuconazole. These medicines are given through a vein or by mouth. Other medicines, including fluconazole, voriconazole, echinocandins, do not work against the fungi that causes mucormycosis. Often, mucormycosis requires surgery to cut away the infected tissues. Now, in a healthy immune environment, resting spores are resistant to phagocytic killing. Swollen spores and hyphae are susceptible to damage, degradation caused by our macrophages and neutrophils. But under the effects of immunosuppression, the efficacy of macrophage and neutrophil activity against mucormycosis becomes reduced, they becomes very less. Hence, they follow penetration of endothelial lining. Mucorales encounter platelets. Platelets adhere to both mucormycosis spores and hyphae and exhibit germination, suppression, and hyphal damage capacity. Dendritic cells are activated in response to mucorales and induce adaptive immunity. Students, it's crucial to further knowledge regarding our immune system's failure to eradicate resting spores under intact immunity and inhibit fungal growth under immunocompromised conditions in order to understand mucormycosis pathogenicity. Here, students, what it says is if our immune system is healthy, definitely we can save ourselves. But if our immune system is weak, definitely our macrophages they'll not be so effective. The neutrophils will not be so effective against mucormycetes. Mucormycosis is an invasive fungal infection characterized by rapid filamentous growth, which leads to angioinvasion, thrombosis, tissue necrosis, the death of the tissues. High mortality rates associated with mucormycosis are not only reflective of aggressive nature of infection, but poor therapeutics currently employed. Also, the failure of human immune system to successfully clear the infection. Immune effector interaction with mucorales is influenced by the developmental stage of mucormycete spores. This is just a brief about what is mucormycosis or mucormycosis disease, which is famously called as black fungus. Nowadays, it is infecting the COVID-19 patients who are treated because of immunosuppression. So I request all the students, especially small children and old people, even everyone who are watching this video, please avoid stress. First thing, avoid stress, avoid fear. Be very positive towards your life. Please eat a lot of vegetables, fruits, which will boost your immune system. Avoid going outside unnecessarily. Follow the government rules and regulations. It is for our own benefit right now. Because if life is there, afterwards we can create wonders. Stay safe, stay home with family. Thank you.